Heart attacks often start quietly, especially in older adults. They whisper rather than shout. The feeling is usually pressure rather than sharp, intense pain. Deep fatigue often appears instead of a sudden collapse, and that small moment of hesitation, the pause before taking action, is frequently where the greatest danger truly begins. Picture the most important decision of your life happening when you are completely alone at home. No one nearby to help, no one to reassure you, and no extra time to think it through. For millions of people each year, that is exactly what a heart attack turns into. I'm Dr. Name, and for more than 25 years I've dedicated my research to cardiovascular health, with a special focus on older adults. Time after time, I've witnessed how just a few minutes of hesitation can change everything in a heartbeat. The simple truth is that what most people know about heart attacks is incomplete. Movies and television usually portray them as sudden, dramatic events with crushing chest pain and people collapsing. But for many, especially seniors, the reality is far more subtle and deceptive. Over the next roughly 20 minutes, I'll guide you through exactly what to do if a heart attack strikes while you're alone, how to spot those easy-to-miss early signs, and a clear step-by-step plan that gives your heart the best possible chance to survive safely. Everything here is grounded in solid evidence from the American Heart Association and leading cardiology centers around the world. Before we continue, take just a moment and type your age in the comments below. I want to understand our community better. Heart attacks aren't limited to any single age group, but they do become much more common as we grow older, and knowing your ages helps me tailor the guidance more precisely for everyone watching. Now let's go into detail about what actually happens inside your body during a heart attack. Information that far too many people only discover too late. As we move into our 60s, 70s, and beyond, our arteries naturally lose some of their elasticity, and plaque builds up slowly inside them. Imagine a garden hose that has gradually become narrower. Blood struggles to flow as smoothly as it once did. Then suddenly, a blockage forms, often when plaque ruptures and a clot develops, cutting off the supply of oxygen-rich blood to part of the heart muscle. This is known as myocardial ischemia, the central issue in a heart attack. To understand this better, think about how the arteries that once were flexible and wide start to stiffen with age. The inner walls collect fatty deposits over decades, much like sediment slowly narrowing a pipe. When a piece of that plaque breaks loose, the body tries to repair it by forming a clot, but that clot can completely block the artery. The section of heart muscle downstream loses its oxygen supply almost immediately. Researchers at the Cleveland Clinic have followed thousands of older adults in different settings, and their findings show again and again that catching these ischemia symptoms early can dramatically reduce permanent damage to the heart muscle by as much as 38% in large-scale studies. That is a meaningful number. It means that quick action can literally save heart tissue from dying. This reduction comes from getting blood flow restored faster, limiting the area that dies off. Every minute saved protects more muscle, which directly affects how well the heart can pump in the years ahead. What surprises a lot of people is that the discomfort often feels like pressure, fullness, or mild tightness in the chest, not the dramatic crushing pain you see in movies. You may have experienced similar chest tightness in the past, after a large meal, during stress, or because of anxiety, and brushed it off as nothing important. But this time, your body could be sending a genuine warning. Don't ignore it. Stay attentive, because these subtle sensations can be the first signal that something serious is beginning. Many older adults describe it as a heavy weight sitting on the chest, or even a mild burning that feels like heartburn. Others feel it spreading to the arms, neck, jaw, or back. The key point is that it does not have to be severe to be dangerous. Almost right away, your body's stress response activates. The sympathetic nervous system releases adrenaline, causing your heart to beat faster and harder. It's like stepping hard on the gas pedal while the fuel line is partially blocked. It only makes the damage worse. Research has shown that anxiety, combined with any delay in responding, particularly when you're alone during a heart attack, can sharply raise the risk of serious complications, according to studies from Johns Hopkins and other centers that have examined the psychological aspects of cardiac events. The extra strain from a racing heart increases oxygen demand at the exact moment when supply is already cut off. This creates a vicious cycle that can turn a small blockage into a much larger problem. This is what makes the situation so difficult. Your body is clearly indicating trouble, yet it's easy to mistake it for normal stress, everyday worry, or simply unusual tiredness after a long day. That internal debate, is this real or am I overreacting, can cost precious minutes your heart simply cannot afford. In those quiet moments alone, the mind often searches for a harmless explanation. Maybe it's just gas, or I'm probably just tired. But those few minutes of doubt add up quickly when every second matters. Heart attacks usually involve a blood clot forming directly on a ruptured plaque. Picture a sudden dam blocking a river, completely stopping the flow in that section. Irreversible damage to the heart muscle can begin in as little as 20 minutes without any intervention. The American Heart Association stresses repeatedly that fast action, ideally within the first hour of symptoms, greatly reduces heart muscle loss and improves overall survival rates. Many people don't realize that even short-lived or intermittent symptoms, like pressure that eases for a while or chest discomfort that comes and goes, may mean a clot is forming or expanding. Waiting to see if it goes away is not safe. It's risky and can lead to much worse results. The clot can grow in stages, so symptoms might come and go, but the underlying blockage is still progressing. As the oxygen shortage continues, electrical disturbances can develop, causing arrhythmias, irregular heartbeats, that can become life-threatening without rapid help. Think of your heart's rhythm as a steady, dependable beat in your favorite music. When it turns chaotic, the entire system begins to fail. Evidence shows that older adults who contact emergency services immediately have a much lower risk of dangerous arrhythmias, often substantially lower than those who wait, based on data from institutions like the Mayo Clinic. This is the point where so many people make a critical mistake. They delay to see if the symptoms pass, believing a short wait won't matter. But in these emergencies, every single minute counts, because damage builds up quickly. If you've ever had unusual chest tightness, unexplained profound fatigue, or sudden shortness of breath, even if it disappeared quickly, please type "alert" in the comments right now. It tells me you're paying close attention to the important signals your body may send in the future. Let me share a couple of real examples to illustrate this clearly. First, there's Robert, 68, a retired man who was generally in good health and lived alone most of the time. One ordinary morning, he noticed mild chest tightness and a sudden wave of fatigue that came out of nowhere. He sat down with his coffee, thinking. Maybe it's just indigestion from last night's dinner. After hesitating for a while, he finally called 911. He later told me, "I really thought I was overreacting. I didn't want to bother anyone or cause a fuss." Fortunately, once help was on the way, we followed what I call the HEART protocol: quick recognition of the signs, an immediate emergency call, chewing aspirin if appropriate, and proper positioning to reduce strain on the heart. Paramedics arrived in about 20 minutes, checked his rhythm right there, and he reached the catheterization lab within the hour. The blockage was treated successfully, and he went home after just 3 days. His blood pressure dropped dramatically from 150/94 to 122/78. He felt much lighter, calmer, and deeply grateful that he had acted fast. That one decision, made without further delay, literally saved Robert's life. Today, Robert walks daily, enjoys time with his grandchildren, and checks his phone is charged every evening as a simple habit. Then there's Linda, 74. One afternoon, while she was reading quietly in her living room, she suddenly felt severe shortness of breath and overwhelming fatigue. There was no obvious chest pain, just an exhausting tiredness that felt crushing. She almost dismissed it as normal aging or poor sleep from the night before. But she remembered a previous conversation with her cardiologist about being prepared for emergencies. She called 911 right away, made sure aspirin was within reach if needed, and unlocked her front door for easy access. Paramedics quickly recognized an active heart attack and got her to the hospital safely. With prompt treatment, she regained her energy and her ejection fraction, a key measure of the heart's pumping strength, improved noticeably from 45% to 55% in just a few weeks. Linda now keeps a small notebook by her chair with her medications listed and tells her friends to do the same. Robert and Linda together demonstrate a powerful truth. Recognizing subtle symptoms early and taking decisive action without hesitation can truly mean the difference between life and death. The approach I'm going to explain in detail has helped hundreds of my patients achieve real heart protection, often during that critical first hour after symptoms begin. I call it the HEART protocol, a simple, easy-to-remember acronym that can guide you even when fear is present during a crisis. Recognize the warning signs. Look for pressure, tightness, unexpected fatigue, or shortness of breath, even if they feel mild or brief. Your job at that moment isn't to make a full diagnosis. Just notice these clues and act right away without waiting. Studies show that early recognition can lead to about 38% less permanent damage to the heart muscle. If you can, write down or note your symptoms immediately, on paper or your phone, including the times when they started or changed. This gives paramedics and doctors precise information about timing and how things progressed when they arrive. Even a quick note on your phone saying, "Chest pressure started at 10:15, now also short of breath," can speed up treatment decisions at the hospital. Next, you make an emergency call immediately. Dial 911 or your local emergency number without any delay. Never try to drive yourself to the hospital. Paramedics can begin life-saving measures right in the ambulance, which gives you a major advantage. The American Heart Association reports much better survival rates when people call emergency services promptly. Keep a fully charged phone accessible in the main areas of your home at all times. This one simple step can save critical minutes. Place one phone in the living room, one by the bed, and make sure the volume is turned up so you can hear it ring even if you feel weak. Then, if it's safe for you, take aspirin. Chew a standard 325 mg aspirin tablet while you wait for help. Unless you are allergic to aspirin, have bleeding problems, or your doctor has told you not to take it. Chewing helps it absorb faster. Research shows this can help limit clot growth and offer extra protection in those early minutes. Keep a small supply of aspirin in convenient places, like your nightstand, kitchen counter, or even in a pocket if you're often alone. Don't store it deep in a cabinet where panic might slow you down. The faster the aspirin gets into your system, the better chance it has to slow the clot from getting larger. After that, rest and position properly. Sit or lie down right away, with your upper body slightly elevated using pillows if needed. This reduces the workload and strain on your heart while making breathing easier. Focus on slow, calm, deep breaths to help ease the adrenaline surge. Think of it as gently calming your engine while the fuel line is still partly blocked. Avoid any extra movement or stress that would increase the strain. Stay in one comfortable position and try to relax your shoulders and jaw. Finally, track and prepare ahead. Make sure your key medical information is visible and easy for responders to find. A clear list of your medications, allergies, and major medical history. If it's safe, unlock your front door so help can enter quickly. This kind of preparation isn't about living in fear. It's about having clarity, staying in control, and gaining valuable time if a real emergency ever occurs. Every small step you take now buys you precious time later. You can keep a brightly colored folder on the kitchen table labeled "For Emergency Responders," with copies of your prescriptions, doctor contacts, and any recent test results. To sum it up, the three most essential actions are: recognize the signs, call emergency services immediately, and take aspirin if it's appropriate for you. These 3 steps alone can greatly improve survival chances and limit damage. The other 2, rest and proper positioning, plus advanced preparation, provide strong additional support for safety and smoother recovery once help arrives. Let's talk realistically about what happens when you start adopting the heart protocol step by step in your daily life. In the first week, your awareness sharpens noticeably. You begin to notice subtle signs much faster than before. Small protective habits start forming naturally with very little effort. You might catch yourself thinking twice when you feel any unusual pressure after a meal. In the second week, your preparedness grows. You automatically keep phones charged and nearby, check that aspirin is accessible, and perhaps write down or post important emergency contacts. From weeks 3 to 4, your response time improves significantly. Even brief or mild symptoms now trigger quick, confident action without second-guessing. After the 4th week, cardiac readiness becomes almost instinctive, like brushing your teeth or locking the doors at night. This isn't something that happens by accident. It's deliberate, purposeful, life-saving preparation that builds steadily over a short period of time. The more you practice these steps in your mind, the calmer you will feel if the real moment ever comes. To be clear and responsible, the heart protocol is not a treatment for ongoing heart conditions, nor is it a substitute for regular medical care. It is strictly guidance for those sudden emergency moments when symptoms appear. Continue taking all your prescribed medications, unless your doctor tells you otherwise. If you have bleeding disorders, an aspirin allergy, active ulcers, or certain heart conditions, please speak with your physician first about the aspirin step. Begin with the safest preparations. Organize your medical information clearly, keep phones charged and easy to reach, and make sure your home allows quick entry for responders. Build this readiness gradually to avoid creating unnecessary anxiety. My challenge to you today is simple. Pick just one part of the heart protocol. Maybe committing to always having a charged phone nearby, or gathering your medical details in one obvious spot. And stick with it for the next 30 days. Then come back and share in the comments how it affected your daily peace of mind, your habits, or your sense of control. Your heart has carried you through so many joys and challenges over the years. Your heart has carried you through so many joys and challenges over the years. It has pumped steadily through the births of your children, the weddings of your grandchildren, the quiet mornings with coffee in hand, and every ordinary day that added up to an extraordinary life. It deserves every chance you can give it, especially in the moments when it needs you most. That is why I created the Free Heart Emergency Checklist, a simple one-page printable that puts the entire protocol right where you need it, on your fridge, by your bedside, or tucked in your wallet. It includes the exact symptoms to watch for, with the subtle ones seniors often miss. A step-by-step checklist you can follow even when fear is clouding your thinking, space to write your medications, allergies, and emergency contacts, and a QR code that links straight to the nearest emergency services in your country. It is completely free with no sign-up or email required. Just click the link in the description, download it, print it, and place it where it can save your life or the life of someone you love. Before you go, I have one more favor to ask. If this video has given you even a single moment of clarity or courage, please do 3 small things right now. Type, "I'm ready," in the comments. I read every single one, and seeing those words tells me this message is reaching the people who need it most. Share this video with one person over 55 in your life. Text it to your sibling, forward it to your neighbor, or play it for your spouse tonight. One share can literally save a life. Hit the subscribe button and turn on the bell. Every week I release new no-fluff guidance on how to protect your heart, your brain, and your independence as the years add up. You are not just watching a video. You are joining a community of people who refuse to let fear win. People who have decided that growing older does not mean growing helpless. Your heart has been loyal to you for decades. Today, you just took the first step toward being loyal right back. Thank you for trusting me with your time and your health. I am Dr. Name, and I will see you in the next video, where we will talk about the one daily habit that cuts heart attack risk by 47% in adults over 65, and it is not what you think. Until then, keep your phone charged, your aspirin close, and your heart even closer. Stay strong, stay ready, and above all, stay alive. Your heart has carried you through so many joys and challenges over the years. It has pumped steadily through the births of your children, the weddings of your grandchildren, the quiet mornings with coffee in hand, and every ordinary day that added up to an extraordinary life. It deserves every chance you can give it, especially in the moments when it needs you most. That is why I created the Free Heart Emergency Checklist, a simple one-page printable that puts the entire protocol right where you need it, on your fridge, by your bedside, or tucked in your wallet. It includes the exact symptoms to watch for, with the subtle ones seniors often miss, a step-by-step checklist you can follow even when fear is clouding your thinking, space to write your medications, allergies, and emergency contacts, and a QR code that links straight to the nearest emergency services in your country. It is completely free. No sign-up, no email required. Just click the link in the description, download it, print it, and place it where it can save your life or the life of someone you love. Before you go, I have one more favor to ask. If this video has given you even a single moment of clarity or courage, please do 3 small things right now. Type "I'm ready" in the comments. I read every single one, and seeing those words tells me this message is reaching the people who need it most. Share this video with one person over 55 in your life. Text it to your sibling, forward it to your neighbor, or play it for your spouse tonight. One share can literally save a life. Hit the subscribe button and turn on the bell. Every week I release new no-fluff guidance on how to protect your heart, your brain, and your independence as the years add up. You are not just watching a video, you are joining a community of people who refuse to let fear win. People who have decided that growing older does not mean growing helpless. Your heart has been loyal to you for decades. Today, you just took the first step toward being loyal right back. Thank you for trusting me with your time and your health. I am Dr. Name, and I will see you in the next video, where we will talk about the one daily habit that cuts heart attack risk by 47% in adults over 65, and it is not what you think. Until then, keep your phone charged, your aspirin close, and your heart even closer. Stay strong, stay ready, and above all, stay alive.